Hello, everyone. For our discussion this week, we are to compare and contrast the down-home model that was discussed in our text with the interdisciplinary model that was discussed in the journal article. And the journal article on the interdisciplinary model for serving vulnerable populations said that case study demonstrated opportunities for collaboration between professional social work, religious organizations, and nursing to reduce health and mental health disparities among these residents in rural areas. So you had all these different disciplines working together. The down home model looks at social work within communities and the important relationships in those communities, but many of these are informal as opposed to the more formal relationships that were talked about in the interdisciplinary model. And in that article on the interdisciplinary model, you uh, had these specific disciplines such as bachelor's level social workers, master's level social workers, student interns, registered nurses, and the religious organization. And the training for the people in the interdisciplinary model was quite formal and precise as well, very specific when they talked about it. The down-home model uses concepts of the Gemeinschaft and the Gesellschaft communities, which can help us look at things that occur within a community, including social, political, and even economic interactions within communities. The Gemeinschaft community is usually more associated with rural areas, and it looks at who a person is in relation to their standing in their community. It looks at things like social relationships, institutions like churches, and how people are viewed within their community. Both the interdisciplinary model and the down-home model use strength-based perspective when working with these rural communities, and both also used different community partnerships to work towards meeting the needs of their clients. Community partnerships like maybe the Red Cross, I think was one mentioned in that article. So both the down-home model and the interdisciplinary model seem to utilize on some level a generalist or advanced generalist method that focuses on the person in their environment. However, I think the down-home method would utilize the generalist method more often, as it was talking about just the social worker rather than several different people with these specialized training and skills, such as social workers with their special training and skills and nurses with their special training and skills. In the interdisciplinary model, you have all these different disciplines, BSW, MSW, nursing, whereas that may not be the case in the down-home model. Both models discussed ethics. Ethics are so important no matter where you're working, if you're working in an urban environment or a rural environment, no matter what method you're utilizing, ethics are of utmost importance. And our social work code of ethics, I think, kind of sets us apart and helps make sure we keep our focus on best serving our clients. So that was super important, and I was glad to see that both models discussed ethics. And these models are different in that within the interdisciplinary model, you have multiple people with special skills available contributing to the care of clients, and you don't necessarily have that in the down-home model. With both of these models, social workers take evidence-based theories such as systems theory and strengths-based theory and utilize them so we can best meet the needs of clients in their community by utilizing a person and environment approach and problem solving. I can see where the down home model is utilized often, but I personally really love the idea of the interdisciplinary model where you have these different people with different skill sets all working towards the same goals for the clients. Thank you.